Bismillahirrahmanirrahim. Assalamu alaikum. A 26-year-old woman come to the office for a routine visit 6 months after the birth of her first child. Her pregnancy and vaginal delivery were uneventful and her infant is healthy. She breastfed for the first 5 months. The patient reported that during the first 2 to 3 months after childbirth, she had excessive anxiety and worried frequently about her newborn daughter. She also felt unusual fatigue and irritable, which had worsened over the last several weeks. The patient also experienced constipation and her appetite is normal and she has gained 2 to 5 kg weight in the last 3 months. Blood pressure is 130 by 90 and pulse is 60 per minute. Heart and lung sound are normal. Mild bilateral lower extremity edema is present. Laboratory results are as follows: hemoglobin 12 gram per deciliter, sodium 113 milligram milli equivalent per liter, potassium 4.2, creatinine 1.1, glucose 100, total cholesterol 280, and total cholesterol 280. Which of the following is the best next step in management of this patient? Cognitive behavioral therapy, echocardiography, exercise and dietary modification, morning serum cortisol, thyroid function test. So first of all, this patient is 26-year-old and she came to the office after 6 months of her first childbirth. During the first 2 to 3 months of her first childbirth, she had excessive anxiety and worried frequently about her newborn daughter. She having unusual fatigue, irritable, and constipation. She had gained 2.5 kg despite normal appetite. On examination, she having mild bilateral lower extremity edema, and her sodium level is 130 milli equivalent per liter. So based on these, hence the diagnosis of this question is hypothyroidism. Diagnosis of this question is hypothyroidism. And the management for hypothyroidism is thyroid function test. Thyroid function studies. So why here the correct option is choice E. Why the choice E is the correct one? Because postpartum thyroiditis occur in 7 to 8% of women after childbirth, which usually occur in the first 6 months. Patient can have a brief hyperthyroid phase due to the release of preformed thyroid hormone, but frequently have only mild non-specific symptoms. For example, anxiety is seen in this patient. The subsequent hypothyroid phase, for example, fatigue, weight gain despite normal appetite, constipation, often bring the patient to the medical attention. Examination typically show a non-tender goiter, bradycardia, diastolic hypertension, lower extremity edema, and other findings. For example, coarse faces, delayed deep tendon reflexes relaxation. In the hypothyroid phase, TSH will be elevated and free T4 level will be low. Other laboratory findings associated with hypothyroidism include hypercholesterolemia, which due to the thyroid effect on lipid metabolism, and hyponatremia. Come to the incorrect one. Why the choice A is the incorrect one? Because cognitive behavioral therapy is for the postpartum depression, and this patient is not suffering from postpartum depression. Choice B, echocardiography. So echocardiography is for the postpartum cardiomyopathy, which occur after the first month of childbirth, and together with these symptoms, the patient also having respiratory symptoms, for example, dyspnea, orthopnea, lungs crackle, and tachycardia. Choice C, exercise and dietary modification. So weight gain, for example, weight gain and hypercholesterolemia and postpartum hypothyroidism usually resolve with the restoration of the euthyroid state. Direct lifestyle and pharmacological intervention are not usually needed. Choice D, morning serum cortisol. So adrenal insufficiency is usually unlikely in this patient in light of associated edema, weight gain, and normal blood pressure. Thank you.